Have you ever reached for a cup of coffee and noticed that one hand suddenly didn't feel quite right? Or maybe you stood up from your favorite chair and for just a few moments, one leg felt unusually heavy before everything seemed normal again. Perhaps you laughed it off, thinking you had slept in an awkward position or simply needed a little more rest. But what if those brief, harmless-looking moments were actually your brain trying to send you an important warning? Many people believe a stroke always happens suddenly and dramatically, with obvious symptoms that are impossible to miss. The truth is often very different. Some strokes, or the warning signs that come before them, can be surprisingly subtle. They may last only a few minutes before disappearing, making it easy to dismiss them as part of getting older. Unfortunately, ignoring these early signals can sometimes allow a much more serious stroke to happen later. If you're over the age of 60, today's video could provide information that may one day help protect your health or even save a life. And make sure you stay with us until the very end, because the final warning sign is one that many people overlook completely, even though it can be one of the most important. As we age, our blood vessels naturally become less flexible. Over time, cholesterol deposits, high blood pressure, diabetes, and other health conditions can make it harder for blood to flow freely through the body. Your brain depends on a constant supply of oxygen-rich blood every second of the day. Even a brief interruption can affect how different parts of the brain work. This is why healthcare professionals encourage people to take sudden neurological symptoms seriously, even if they disappear quickly. Sometimes those brief episodes are caused by a transient ischemic attack, often called a TIA or mini-stroke. Although the symptoms may go away, a TIA is often considered an important warning sign that a larger stroke could occur in the future if the underlying cause is not addressed. The encouraging news is that learning to recognize these warning signs gives you the opportunity to seek medical attention sooner. Quick action can make a tremendous difference. Let's begin with one of the most common warning signs. The first silent stroke warning sign is sudden weakness or numbness on one side of the body. Imagine you're carrying groceries into your kitchen. Without warning, your right arm suddenly feels weak. The grocery bag slips from your hand even though it isn't particularly heavy. Or maybe you're walking across your living room when one leg suddenly feels strange, making you stumble slightly. These symptoms may last only a few minutes before disappearing completely. Because they improve so quickly, many people convince themselves that nothing serious happened. They blame poor circulation, arthritis, a pinched nerve, or simply getting older. However, weakness or numbness that appears suddenly, especially on only one side of the body, is one of the classic warning signs of a stroke. This happens because one side of the brain controls movement on the opposite side of the body. If blood flow to that area is interrupted, even briefly, your muscles may stop responding normally. Pay close attention if you notice sudden weakness in your face, arm, or leg, particularly if it affects only one side. Even if the symptoms disappear within minutes, it's important to seek immediate medical evaluation. Waiting to see if it happens again could be a dangerous mistake. Now, while weakness is a warning sign many people have heard about, the next symptom is often much easier to miss because it can sound like ordinary fatigue or distraction. The second silent stroke warning sign is difficulty speaking or understanding words. Have you ever known exactly what you wanted to say, but the words simply wouldn't come out the way you intended? Maybe you started a sentence and suddenly couldn't remember a familiar word. Or perhaps a family member looked at you with concern and asked, "Are you feeling okay? Your speech sounds different." These moments can be frightening, but because they sometimes last only a short time, they're often ignored. Speech problems during a stroke happen because certain areas of the brain are responsible for producing and understanding language. When blood flow is interrupted, those areas may not work properly. A person may slur their words, struggle to finish a sentence, use the wrong words without realizing it, or have trouble understanding what others are saying. Imagine talking on the phone with a friend when, all of a sudden, you can't get the right words out. You know exactly what you want to say, but your mouth doesn't seem to cooperate. Or perhaps someone is speaking to you clearly, yet their words suddenly stop making sense. These changes should never be dismissed as simple tiredness or normal aging. If you or someone around you suddenly develops trouble speaking or understanding language, treat it as a medical emergency, even if the symptoms improve after a few minutes. And while speech problems can certainly be alarming, the next warning sign often affects something many of us take for granted every single day: our eyesight. Surprisingly, countless older adults mistake it for an ordinary eye problem when it may actually be coming from the brain. The third silent stroke warning sign is sudden changes in your vision. Most of us expect our eyesight to change as we get older. Reading small print may become more difficult, colors may seem less bright, and many people eventually need stronger glasses. Because these gradual changes are so common, it's easy to assume that any new vision problem is simply another part of aging. But a silent stroke can affect your vision in a very different way. Instead of slowly getting worse over months or years, the change often happens suddenly. You may notice that everything becomes blurry in one eye, or you suddenly begin seeing double. Some people describe it as if a curtain has been pulled over part of their vision. Others notice they can't see objects on one side, even though their eyes seem perfectly normal. Imagine sitting down to read your morning newspaper. You look at the page, but half the words seem to disappear. Or perhaps you're watching television and realize you can only see part of the screen unless you turn your head. While driving, you might fail to notice a car approaching from one side or overlook a pedestrian crossing the street. These symptoms can be especially dangerous because they increase the risk of falls and accidents. Many people immediately assume they need a new eyeglass prescription or believe cataracts are causing the problem. While eye conditions are certainly common in older adults, sudden vision changes should never be ignored. In many cases, the eyes themselves are healthy. Instead, the part of the brain that processes visual information isn't receiving enough blood. If your vision suddenly becomes blurry, doubles, or partially disappears, seek medical attention immediately. Even if your eyesight returns to normal a few minutes later, it's important to find out what caused the episode. Now let's move to another warning sign that many people blame on dehydration, an inner ear problem, or simply standing up too quickly. Although those can certainly cause dizziness, there are times when the real cause may be far more serious. The fourth silent stroke warning sign is sudden dizziness or difficulty with balance. Nearly everyone has experienced occasional dizziness. Maybe you got out of bed too quickly or skipped a meal and felt lightheaded for a few moments. Usually, those feelings pass without causing much concern. Stroke-related dizziness is often different. It tends to appear suddenly and may be accompanied by difficulty walking, poor coordination, or an unusual feeling that the room is spinning around you. You might feel unsteady even while standing still. Simple tasks like walking across your kitchen or climbing a few steps suddenly become much more difficult than usual. Picture yourself walking through your home. Without warning, you begin drifting to one side. You reach for the wall to steady yourself, even though nothing around you has changed. Family members may notice that your walk suddenly looks uneven or that you seem unusually clumsy. The reason this happens is that the back part of the brain helps control balance, coordination, and smooth movement. If blood flow to this area is interrupted, your body may have trouble staying steady, even if your muscles are still strong. Because dizziness has so many possible causes, some people choose to rest, drink water, or lie down, hoping it will pass. While that may be appropriate for mild dizziness caused by dehydration or standing too quickly, sudden dizziness combined with poor balance, vision changes, weakness, or trouble speaking should always be treated as a medical emergency. The sooner doctors can determine the cause, the better the chances of preventing further damage. So far, we've talked about warning signs you can see and feel: weakness, speech problems, vision changes, and loss of balance. But the next two signs are often even more surprising because they affect the way the brain thinks and communicates. Many people mistake them for simple forgetfulness or stress, when they may actually be signaling something much more serious. The fifth silent stroke warning sign is sudden confusion or unexpected problems with memory and thinking. As we grow older, it's perfectly normal to forget small things from time to time. You might walk into a room and forget why you went there. You may misplace your reading glasses or struggle to remember someone's name for a few moments before it comes back to you. These occasional lapses are common and usually happen gradually over time, but the kind of confusion that can accompany a silent stroke is very different. Instead of slowly becoming more forgetful over months or years, the change happens suddenly. One moment you're thinking clearly, and the next, familiar tasks become surprisingly difficult. You may struggle to follow a simple conversation, forget how to use an appliance you've operated for years, or become confused in a place you know well. Imagine preparing your usual morning breakfast. You've made the same meal hundreds of times, but suddenly you can't remember what step comes next. Or perhaps a family member asks you a simple question, and although you hear the words, you have trouble understanding what they're asking. Sometimes the people around you notice the change before you do. They may say you seem unusually distracted, confused, or that your answers don't quite fit the conversation. This happens because different areas of the brain are responsible for memory, attention, and decision-making. When blood flow is interrupted, even briefly, these functions may stop working as they normally do. It's important not to dismiss sudden confusion as just getting older. While many conditions can cause temporary confusion, including infections, low blood sugar, or certain medications, a sudden change in thinking should always be taken seriously, especially if it appears alongside weakness, speech problems, dizziness, or vision changes. Prompt medical evaluation can help determine the cause and ensure that appropriate treatment begins as quickly as possible. Now let's look at another warning sign that often creates confusion because headaches are so common. Nearly everyone has experienced one at some point in life. However, not all headaches are the same. The sixth silent stroke warning sign is a sudden, unusual headache. Most headaches develop gradually. They may be caused by stress, dehydration, lack of sleep, eye strain, or even skipping a meal. These headaches often improve with rest, hydration, or treatment recommended by your healthcare provider. A headache related to a stroke may feel very different. Many people describe it as a headache that comes on suddenly and is unlike anything they've experienced before. It may be unusually intense or simply feel strange enough that something doesn't seem right. In some cases, it may be accompanied by nausea, confusion, dizziness, blurred vision, weakness, or difficulty speaking. Imagine enjoying a quiet afternoon when, without warning, an intense headache begins. Within minutes, you also notice that your speech feels slightly slurred or your vision becomes blurry. Those symptoms together deserve immediate medical attention. It's important to remember that most headaches are not caused by a stroke. However, a sudden, severe headache, especially when it appears together with other neurological symptoms, should never be ignored. Healthcare professionals recommend treating this combination of symptoms as a medical emergency. We've now covered 6 warning signs that may appear before or during a silent stroke. But the final warning sign may be the most overlooked of all because it often disappears before anyone has the chance to react. Many people assume that if the symptoms go away, the danger has passed. In reality, those brief episodes can be one of the brain's most important cries for help. And that's exactly what we'll discuss next. The 7th silent stroke warning sign is when symptoms appear briefly and then disappear. This may be the easiest warning sign to ignore and perhaps the most dangerous. Imagine you're having breakfast with your spouse. For about 5 minutes, your speech becomes slightly slurred. Then, just as suddenly as it started, everything goes back to normal. Or perhaps one arm feels weak while you're folding laundry, but by the time you consider calling someone, the weakness has completely disappeared. Most people would feel relieved. They might think, "I'm fine now," or "it must have been nothing." But temporary symptoms should never be ignored. In many cases, these brief episodes are caused by a transient ischemic attack, or TIA, sometimes called a mini-stroke. A TIA happens when blood flow to part of the brain is blocked for a short time. Because the blockage clears quickly, the symptoms often disappear within minutes or hours. However, a TIA is an important medical warning. It can be a sign that a full stroke may happen in the near future if the underlying cause isn't identified and treated. Think of it like the warning light on your car's dashboard. The light may come on before the engine fails completely. Ignoring the warning doesn't fix the problem. It simply increases the chance that something much more serious will happen later. That's why healthcare professionals recommend seeking immediate medical attention after any sudden neurological symptoms, even if you feel completely normal afterward. Doctors can perform tests to determine what happened and recommend treatments or lifestyle changes that may help lower the risk of another event. So what can you do to reduce your risk of stroke as you get older? While no one can prevent every stroke, there are many proven steps that support brain and heart health. Start by knowing your blood pressure. High blood pressure is one of the biggest risk factors for stroke, and it often causes no symptoms at all. Regular checkups can help you catch problems early. If you have diabetes or high cholesterol, work closely with your healthcare provider to keep those conditions well managed. Following your treatment plan can help protect your blood vessels over time. Try to stay physically active in ways that are safe and enjoyable for you. A daily walk, gentle stretching, swimming, or even gardening can help improve circulation, support heart health, and maintain strength and balance. A balanced diet also plays an important role. Eating plenty of vegetables, fruits, whole grains, beans, healthy fats, and lean proteins can support healthy blood vessels. Reducing excess salt, added sugars, and heavily processed foods may also benefit your overall cardiovascular health. If you smoke, consider talking with your healthcare provider about resources to help you quit. Stopping smoking is one of the most effective ways to reduce the risk of stroke and many other serious health conditions. Don't forget the importance of quality sleep and regular medical checkups. Conditions such as atrial fibrillation and irregular heartbeat may not cause obvious symptoms, but can significantly increase stroke risk if left untreated. Routine health visits can help identify these issues before they lead to complications. Most importantly, trust your instincts. You know your body better than anyone else. If something suddenly feels different, whether it's weakness, trouble speaking, changes in vision, dizziness, confusion, or an unusually severe headache, don't wait to see if it gets worse. Seeking medical attention quickly could make all the difference. Let's quickly review the 7 silent stroke warning signs we've covered today. Sudden weakness or numbness on one side of the body, difficulty speaking or understanding words, sudden vision changes, dizziness or loss of balance, sudden confusion, an unusual severe headache, and temporary symptoms that disappear after a short time. Recognizing these warning signs doesn't mean you should panic. It means you can act quickly and give yourself or someone you love the best possible chance of receiving timely medical care. Thank you for spending your time with us today. We hope this information helps you feel more informed and confident about protecting your brain health. Now, we'd love to hear from you. Which of these 7 warning signs surprised you the most? Have you or someone you know ever experienced one of them? If you're comfortable sharing, tell us your age and the country you're watching from. Your story could help someone else realize the importance of paying attention to these early warning signs. If you found this video helpful, consider sharing it with a friend, neighbor, or family member. Sometimes one simple conversation can make a life-changing difference. Until next time, take good care of yourself, stay active, stay informed, and remember, your health is one of your greatest treasures, and every small step you take today can help protect your tomorrow.